When you're picking an orthodontist for your child, it's easy to think it's all about one thing, getting that picture-perfect, straight smile. But what if that decision was actually one of the most important things you could do for their overall health? You see, sometimes the clues to much bigger questions are hidden in plain sight, in the way your child sleeps, how they breathe, and yep, even the shape of their jaw. Okay, let's get into it. So, maybe you've noticed it. Your child snores, or they seem to always be breathing through their mouth, even when they don't have a cold. I know, it's so easy to just brush that off as something kids do. But these are often really important warning signs that something's up with their airway. And a blocked airway, well, that doesn't just mess with their sleep. It can set off a whole domino effect, impacting everything from their development and mood to how they do in school. Now this is where it all clicks into place. Look at this. On one side, you have all the stuff happening at night. The snoring, the tossing and turning, maybe even things like night sweats or bedwetting. And then, on the other side, you have what you're dealing with all day long. A child who's hyperactive, sometimes even misdiagnosed with ADHD, who's struggling in school or just seems irritable all the time. This shows they're not separate issues. That rough night's sleep is very often the direct cause of the tough days. Okay, so we can see the symptoms. The next obvious question is what's actually causing all this? And that brings us to this really crucial link between a child's airway and how their face and jaw are growing. The official medical term for this is often pediatric obstructive sleep apnea, or OSA for short. And really, all it means is that while your child is asleep, something is physically blocking their upper airway, which makes them stop breathing for a few seconds, over and over again. And while it might seem like a small percentage of kids, for the ones who have it, it's a really big deal. So what's the culprit here? Well, the most common reason by far is enlarged tonsils and adenoids. Things like obesity or a tongue tie can also be a factor. But the one we're going to zero in on today is related to the actual shape of the face, specifically a narrow upper jaw. And that right there is where your orthodontist suddenly becomes a very important part of this story. And this leads us to the big question that so many parents are asking now. If a narrow jaw is part of the problem, can an orthodontist just fix it? And by fixing the jaw, can they fix the sleep apnea? It sounds super promising, and one treatment has gotten a ton of buzz. That treatment is called rapid maxillary expansion, or RME. You've probably heard it called a palatal expander. It's this little device that gets placed on the roof of the mouth, and over a few months, it very gradually and gently widens the upper jaw. Now, the main goal is to make more room for teeth, but the theory is that it also opens up the nasal passages and helps with breathing. And, there's a solid case for it. Lots of studies have shown that structurally, RME does what it's supposed to do. It really does increase the size of the nasal cavity, it can create more airway space, and many orthodontists will tell you they see kids breathing better through their noses. So logically, it seems like a total home run for fixing pediatric OSA, right? But, of course, science is all about testing our assumptions. And then, in 2022, this major review came out. And when I say major, I mean it. This was a systematic review, which is pretty much the highest level of scientific evidence you can get. Researchers gathered up all the best studies on this exact topic, and what they found, well, it was a bombshell. The conclusion was just stark. They said they couldn't find convincing evidence that using an expander was any better than watchful waiting. And watchful waiting is just the scientific way of saying doing absolutely nothing. So this completely challenges that whole idea that an expander is a guaranteed fix. So what on earth is going on? The answer is kind of wild. It turns out that sleep apnea in kids is totally different than in adults. In adults, it gets worse over time. But in kids, a huge number of them just grow out of it. We're talking a staggering 69 to 100% rate of spontaneous remission. They just get better on their own. So any treatment has to prove it works better than just letting time and nature do their thing. And this slide really tells the story. It shows the data from the only major study that put RME head-to-head with doing nothing. Now, this AHI number, that's just the main way they measure how severe the sleep apnea is. So after 5 months, the kids with the expander saw their scores drop by 28%. Pretty good. But look at the kids who just waited. Their scores dropped by 33%. Statistically, that's the same. The expander didn't beat the clock. So, does all this mean orthodontists have no role to play? No, absolutely not. It just means we have to be super clear about what their role is. It's not about one person trying to solve everything alone. It's about building the right team for your child. And hey, don't just take my word for it. The American Association of Orthodontists, their own governing body, made this crystal clear. They said, flat out, that diagnosing sleep apnea is a doctor's job. An orthodontist can't and shouldn't be the one to make that final call just by looking at your child's teeth. So here is what the right path actually looks like. Step 1, it starts with screening. A great, forward-thinking orthodontist or dentist will be on the lookout for risk factors. If they see those red flags, their job is to then refer you to a physician, like an ear, nose, and throat doctor or a sleep specialist. That doctor makes the official diagnosis, usually with a sleep study, and only then does everyone come together as a team to figure out a plan. And that plan might include orthodontics, but as one piece of a bigger puzzle. And honestly, just knowing this process is so powerful. It puts you in the driver's seat. It gives you the tools you need to ask all the right questions and to be the absolute best advocate for your child. Okay, so here's your cheat sheet. These are the questions to bring with you to that orthodontic consultation. Ask them straight up. Do you screen all kids for airway issues? Ask how they work with other doctors. And this is a big one. Ask them if their goal is just straight teeth or if they're looking at your child's overall growth and health. And if they do recommend an expander, ask them to explain exactly why it's right for your child. Their answers are going to tell you everything you need to know. And that really brings us right back to where we started. Choosing an orthodontist today, it's about so much more than just getting straight teeth. It's about finding a professional who sees the whole picture, someone who gets the deep connection between the mouth, the airway, and your child's health. It's about finding a true partner who will help you build the right team so your child can not only have a beautiful smile, but can also breathe well, sleep well, and truly thrive.